I think back to an old saying that someone said to me once: if you have to do anything twice on a computer, there's a quicker way of doing it. You just need to know.
Welcome to Data and AI Mastery, the podcast where we bring you cutting-edge insights, practical advice, and inspiring stories from the leaders shaping the future of data and AI across the globe. I'm your host, Raoul-Gabriel Urma, founder of Cambridge Spark, the leader in transformational data and AI upskilling, career development, and progression. In each episode, I will be diving into real-world case studies of companies harnessing the power of AI to drive innovation, reduce costs, and create new business opportunities. So whether you are an aspiring data scientist, AI engineer, or seasoned executive, this show is designed to give you the tools and knowledge to stay ahead in a world where data is transforming every aspect of business. Stay ahead, stay inspired, stay masterful. Welcome to Data and AI Mastery. Hey Dan, good to see you. Welcome to the show. How are you doing?
I'm good, Raoul. Thank you very much. Thank you for the invite. It's an interesting podcast you've got, so I'm looking forward to being part of it instead of listening.
Well, thank you. And I think you have a great story to share, so I look forward to deep dive. So Aidan, you're the head of data standards at Nuffield Health, UK's largest healthcare charity. So that's really cool. And I'm very intrigued by your journey on how you got there, into a data leadership position. So can you walk us through the path?
Yeah, absolutely. So I think for me, I'd say I've come at data more from a domain expertise from health as opposed to a specific kind of data heavy expertise. Really, I'd say I've led a career broadly underpinned by data-driven decisions. So I started off as a PT whilst I was doing my degree, and a sports scientist when I was doing my kind of MPhil in genetics, and then when I moved to Nuffield, I was a physiologist and led some of our early clinical research into some of our programs, our kind of broader programs for all pathways that kind of address unmet needs. And my stake in all of those was, how do we capture the type of data that we want that will help us quantify the impact of those programs to the patient or the beneficiary or the participant, how we can then use that data to quantify our broader social values as a charity. And then from there, really, I was asked to say, well, we're doing fantastic work over here in these rehab programs that you've kind of jointly set up. How can we take that logic, that outcome framework logic, and apply that across the charity? So I designed an outcome strategy for the whole of Nuffield, and really it was there that we started to realize that actually, to deliver that outcome strategy, that kind of North Star for me, actually what we need to do is we need to improve broadly across Nuffield our data quality, our understanding of data, our availability of data, and the skills for people across the organization to make best use of that data. So yeah, I ended up basically leading the data strategy, and here I am now.
Super cool journeys. Well, since you mentioned, like the initial steps at Nuffield Health and the UK's largest healthcare charity, can you walk us through what was the first impactful program you designed? What did you have to measure? What's kind of like the data collection process like? And ultimately, what's the outcome? Maybe we can start with that initial story.
Brilliant. Yeah, absolutely. So we initially set out to address unmet public health needs. So we started with initially a joint pain program. So the MSK is the kind of second biggest expenditure for the NHS, but there wasn't at the time a national scaled program that supported people broadly with joint pain. We designed a program for that, and then during COVID, I think the kind of more interesting or more pertinent story is our COVID rehab program. So in 2020, I came back to design a program to help people recover from COVID-19. But we just knew there was something happening. People aren't recovering as quick as they normally would from a viral infection en masse. It was impacting a lot of people. So we designed a program and we scaled it out. And in terms of, you asked about outcomes, for us, if a program is going to work, for me, it has to do a number of things. It has to improve the quality of life of the person going through the program. It has to improve clinically what it is that program exists to do. If it's a joint pain program, it has to improve your joint pain. Otherwise, it's no good in doing it. And then more broadly, we want to understand if there are kind of secondary impacts. So understanding healthcare burden, healthcare utilization? Have have we reduced the amount of time you spending GP surgeries, for example? And then productivity gains, right? If you were out of work because of this condition, can you now go back to work? And we package all of that up in a kind of a social value framework that we use called social return on investment. And in 2024, we were able to evidence a social value of £124 million.
Very interesting. So, what would be the sort of framework to design such a program? Can you walk us through a little bit? What are the inputs? What are the outputs? And it sounds like through the design phase, you realize there's quite a lot of things we could measure. Can you walk us through that?
For sure. So a standard outcomes framework, you have inputs, they create outputs, they lead to outcomes, and those outcomes lead to impact. I think for me, the easiest way to start with any of this is to start with the impact. What is it this thing is going to do? If it works really well, what is the newspaper headline? In a perfect world, and then work back from that. Okay, well, if it's going to improve quality of life, well, you need to measure quality of life. But if you're going to say that quality of life improved, you want to understand why. Or if quality of life didn't improve, you really want to understand why. So then you start to collect clinical data or patient-reported outcomes. And then you kind of say, well, if we want to understand that, what if it doesn't work? Well, we want to understand things like attendances, drop-offs, swipes into our gyms, and you kind of put all that together. You basically have an outcomes framework, if you will, of lots of data at lots of points, and some of it is purely there to assess impact, and some of it is more inferential. It helps us understand why.
Yeah. Wow, that's super cool. So you start with the impact, and then you think about what are the outcomes driving this big like headline impact that we're thinking about, what are all the outputs driving the outcome, and what's the input driving the output. So that's a really nice way to think through it. So you did that with this program, and then clearly very successful. So what was the next step? Like, how did you think about, broadening the scope of this program to maybe organizational wide?
Exactly. Yeah. So that if we take the COVID-19 rehab program, just to give you kind of an idea of scale, we kind of went from an idea in 2020 to a pilot by the end of 2020. We ran a whole pilot. In 2021, we were scaling up across. So we have a network of 110 gyms, and we were scaling it up across the organization. And we had enough data such that in the summer of 2021, we provided expert testimony to NICE, who were updating their long COVID guidance. So that was for me, a really nice testament to that outcome framework approach and the benefit it can have. But I think exactly to your point, what's the wider impact? Well, our exec were able to see at the time that if we were to take that logic and have that equivalent information across every pathway, Nuffield have, hospitals, gyms, we have primary care procedures, so GP surgeries, physiotherapy, health assessments. If we had that quality of data for all of those pathways, clinical and non-clinical, we will be in an incredibly powerful position. So I basically kind of designed the outcome framework, the approach I talked about there, and we came up with kind of a ubiquitous outcome strategy. If you could only collect one thing, collect this. If you must collect more, collect that. If you want to understand inference, which consultant was best or worst, or which site is performing highest, you need to collect all this operational and process data. So for me, the strategy was in kind of the outcome strategy, if you will, was in 3 layers.
Okay, great. So essentially, through the success of this initial program, kind of like came up with a unified framework to apply it across the organization, because it helps, the execs understand the impact and how it's derived. That makes a lot of sense. Now, clearly, there must be a lot of variety of data as soon as kind of you broaden the scope. Can you walk us through a little bit? What are examples of different types of data that suddenly one may have to think, maybe across, inputs and outputs? How does that look like? Because you mentioned, gym swipes. You mentioned actually patient records. So there must be, unstructured data too. So how does that look like?
Exactly. So, I think really that outcome strategy was actually the precursor to what became the data strategy, because as part of that, we had my outcome strategy has this central pillar of saying, like, we exist to build a healthier nation. If our pathway is not improving quality of life, there is a problem, And then we have the second layer, which is saying, well, it might improve quality of life, but does it improve whatever that pathway exists to improve? If it's a joint replacement pathway, is the patient's quality of life, is their function as a consequence better? Their experience is part of that kind of second layer as well. So is the patient's experience better? But then all around it, we have this process and operational layer, which you talked about there in terms of swipe data, for example. For me, that's the causality. If you've got that data, that can help you with inference and help you understand why something may have gone the way it did. And that for us was really the start of the data strategy, because we've realized to really properly document that, we have to know what data we're capturing everywhere. And at the time, that wasn't widely known across the organization. Obviously, within various areas, people know their world very, very well. But centrally, we didn't have a brilliant view of all of that. So we really kind of, the outcome strategy, if you will, just became one work stream of the broader data strategy. And yeah.
Yeah. So that's really interesting. So what I really like here is you clearly have a North Star, which is, we want to save his life, we want to improve lives. And that brings the whole organization behind. So I think that's extremely powerful. And many organizations that maybe are not in health can learn from that, where the idea of this North Star. And by the sound of it, going through the outcome strategy, you realize actually we need to set up a data strategy to support it. That's very interesting, because you'll hear a lot of organizations, they always start with a data strategy that is not connected to the business, but here it's kind of like, actually, it's very much to support the business. So when you went through this process of, figuring out what's going to be the data strategy, what came out of it? I imagine that, there was realization like we need to invest in data infrastructure, we need to invest in people. Maybe we can talk about that in a moment. So, walk us through those concerns, maybe.
For sure, yeah. So you're absolutely right. I mean, everyone will be familiar with people, process, technology. The kind of three things you need to deliver most things. And for us, technology was a huge angle, a huge element of that. We have a lot of disparate systems because of our organization, the way it's set up with the various units, if you will. So we have a lot of disparate systems, and some of them required investment. So we are on a journey with our exec to kind of get investment in that. So things like data cataloging, for example, data retention is a key challenge and opportunity for us as part of our strategy. But as well as that, people and process. Well, the governance is a huge area of that. So, making sure that we can work with our procurement teams to understand that if we're going to buy a system, unless it's the only one in the world that does that, it must allow us to extract data out of that system, and must allow us to see that information in some form or another, so that we can glean insight out of it. I don't just want to be able to download an actual report. I want access to the information.
And I imagine, given your industry and the patient data, governance is especially important.
Exactly, it's critical. So both from a brand and reputation perspective, but also from an information security perspective, our patients trust us to deliver the best care and experience for them, and for that, absolutely, we need to make sure that our data is secure, but that we can turn that data into information and turn that information into action.
Great. And then what about the people part?
And the people part, yeah. I mean, for us, data literacy was a key area of development. And I think, for me, it's one area in the data strategy that I think delivers probably 3 times over. So think of people in my situation who might be at the start of their data strategy. There's kind of the broad panacea everyone wants to get to, data-driven decision making, and from that everyone wants to get data self-service. We should be able to go and get our data from a data mart or whatever, and it's clean, it's curated, it's documented, fantastic. Initially, what we focused on was investing the apprenticeship levy into data skills, into data literacy at that foundational level. So our organization, people already have access to information. What we focused on initially was making sure that they could use that information they already have access to as efficiently and productively as possible. And with our data apprenticeships, we were able to deliver incredible value very, very quickly. Like within the first 12 to 18 months, we've saved, on average, everyone that's gone through the apprenticeship has reported about a 20% improvement in time efficiency. So it's not that they have more free time, it's that they have more time to focus on the insights and action, as opposed to focusing on the curation and cleaning, if you will. That's the first kind of quick win for me for data literacy. And because of that, that win allows you some breathing space and time to deliver some of the more foundational process and technology challenges that are really, really important, but they're not that fun. And there's not too many exciting things you can say about them, but they need to be done. So I think that's the second benefit. It buys you time. And that third benefit for me is, as part of that data strategy, we will absolutely get to a place where we have data self-service enabled at scale. And at the same point as that happens, we will have a workforce who have the skills and the capabilities to fully leverage that. And so I think it's about trying to balance those two trajectories, if you will.
Can you walk us through how do you see the timeline, right? Like you're starting now, if we focus on the people conversation, you're starting kind of like the broad data literacy. How long will that take? And how do you measure that, my workforce is data literate?
I think for me, how long will it take? There is an ambition that by the end of 2027, we will be in a much better place with data. We will have it curated, documented, available in some format via self-service, for example, and that we will have a workforce making best use of it. But we're already in pockets doing some fantastic work. So like I say, some of our data literacy as data apprentices are delivering fantastic value. So I think in procurement, for example, we've got savings in excess of £1 million, because for us that's a huge area of spend, and you don't have to move the needle far to make big improvements. But the apprentices that were from procurement that went on the apprenticeships were basically able to apply those skills to save a lot of money for Nuffield. And will obviously continue with those newfound skills more efficiently than they will have done before.
That's great. So it's really beautiful when you empower individuals in the business functions in the team with the right skills, then magic happens, right? So here's a good story how an investment data literacy is driving like business ROI. £1 million is massive ROI. So that's very cool to hear.
And that's just one example, right? We've got, as well as kind of foundational data literacy, we also have advanced analytics and capabilities, which I'm sure you'll come on to.
Hey, well, since you bring it up, I'd love for you to walk us on this journey, right? So you've got the data literacy investment that's ongoing. It's delivering impact. What's next?
So yeah, we are already seeing fantastic benefits of from our data in-house. So we have advanced analytics capabilities in our organization. So my colleague, Dr. Kevin Deaton, and his team have led some fantastic machine learning and AI projects that have really delivered a lot of value for the charities. So a couple of them, I'll touch on one. He built a case mix adjustment model. So in healthcare, we collect patient-reported outcomes, and basically Kevin provided a statistical model that allows us to almost compare different patients and different consultants with all of their outcomes like for like. And that helps us to improve health equity. And as far as we're concerned, it's industry leading, and actually not too long ago was award winning. So it's a fantastic example of, if we can get our data of sufficient quality, we can do amazing things with it for the benefit of the patient. But then another example is our work on theatre ventilation. So for us, until recently, our theatre air handling units were always on. You don't turn those off even at night, and we don't do emergency surgeries. We're not running people into hospitals at 2 a.m. And we worked with Kevin and a team to basically conduct degree day analysis, so quite advanced analytics, to understand the impact of turning off the air handling units, both on our energy, so huge sustainability win, but also on things like infection prevention. So obviously that's a key area as why those air handling units were always turned on. But we were able to use data from that to show that we can turn those off, that there is no risk to patients, and actually there is a huge sustainability win for the whole industry. And actually we've supported a recent publication, and I think it got published last week, talking about that, and we're going to release our own report in the next month following up that, for us, I think that's a prime example of where we can be using data to advance healthcare as an industry.
Oh, beautiful. So I love that if you've got the data at hand, you can get ROI through data literacy and upskilling, the wider workforce to make better decisions and identify opportunities, but also with more advanced capabilities. So we think about data science and machine learning, clearly a more advanced skill set, but you're able to drive innovation and move the needle. So that's super cool. So that's really interesting because we talk about skills, from like foundation level all the way to advanced. What advice do you give, if someone's thinking, "Hey, should I upskill? Is this for me?" How do you encourage them to kind of like, take on an apprenticeship program as an example to keep on upskilling in your career?
Absolutely. I mean, I'm probably the most biased person when I think of upskilling. I'm telling people it's great, it's fantastic, and they're like, it's your job to tell me that. I let the other apprentices sell it for me in essence. So the benefits that they've delivered. We have colleagues in house who've been promoted because of the skills they've got from their data to help them set themselves apart from their colleagues, and that has resulted in them being promoted as a consequence of that. So for me, I think there's examples of career development there. But I think as well, I think back to an old saying that someone said to me once, if you have to do anything twice on a computer, there's a quicker way of doing it. You just need to know. And
Cool.
and I think about that a lot.
That's great. I like how you bring it back to career development, career outcomes, and also business impact. It's like you've got both of them. So those are great results. Well, thank you, Aidan. Can I take you to a quick fire round of questions?
Fantastic.
Basically ask you a question, short answers.
Yeah, let's go for it.
All right. So first one, I always like to ask because I always learn something new. What is a contrarian view you have in the industry?
I don't know if it's a contrarian view. I hope it is. For me, I think data doesn't save lives or improve health. Decisions do, and they are better with data.
I like that. Yeah, I see what you mean, whether it's contrarian or not. But, we often think that if we have the data, it solves all problem. By the end of the day, you got to take some action with it. So I'm on your camp. Beautiful. Then the next one, a lot of our audience is, clearly listening because they want to learn what's happening in the industry and keep up, right? And it's moving so fast. So what do you do yourself to make sure that you stay up to date?
So yeah, I mean, for me, outside of podcasts, I love to hear how everyone else is solving problems. So I try and network as much as I can, and that's everything from trying to find my my counterparts in other organizations and connecting with them on LinkedIn, to going to taking advantage of conferences. There are so many conferences. I think I probably only go to a couple a year, but you could probably go to about 3 a week if you accepted every invite. So but I find them really interesting. Like I went to Gartner a few years ago, and AI was quite a niche thing. And I went to Gartner this year, and every single stand had AI, and you see that industry shift. So yeah, I think for me, I try and network, I try and speak, and I try and hear what problems people are solving in their world, and that gives you an indication of kind of, I guess, the root of challenges.
Great. Podcast, networking, conferences, peer learning. Love it. And finally, maybe in the context of data in healthcare, like if you had a magic wand, what do you wish you could, solve or make easy?
Yeah, I think for me, data literacy and data self-service, but in that order.
Great. Well, I can help you with the data literacy part for sure.
Yes, brilliant.
Maybe a few more personal questions now, Aidan. What was your favorite subject back at school?
Biology.
Nice.
Easy.
I guess that kind of makes sense.
Yeah, I suppose it does now. Yeah.
All right. And what was your favorite music genre?
At the minute, I'm listening to an awful lot of Irish trad music. It's getting me through my final days of my PhD. I have no idea why.
Hey, whatever gets you there, PhD is hard. So whatever gets you to that final viva. Brilliant, Aidan. It's been an absolute pleasure to have you on the show today.
Great. Thank you very much, Raoul, and thank you for the invite.
super insightful discussion with Aidan. What a rich conversation. There's a few nuggets that I particularly enjoyed. One was this framework that Aidan described around designing programs and interventions, thinking about the impact from the start, the outcomes that are driving the impact, the outputs that are driving the outcomes, and then the inputs that are driving the outputs. Having this framework is really helpful because it naturally leads to a discussion around what are data needs and how do they fit in those buckets. And as a result of that, I like how that naturally create a conversation around the data strategy for the organization and how it's linked with the organization purpose. And as part of data strategy, we talk about three components: the technology, the process, and the people. And Aidan articulated really well the different needs, right? So clearly you need to invest in technology and foundational needs around data infrastructure, storage, collection, cataloging, and so on. It's like having a house, right? If you got poor foundations, then it's going to crumble. So you do need to invest in technology. Then you also need to invest in processes, and specifically here, big investment in governance, in security, and safety, because you're dealing with sensitive data. It could be very much reputationally damaging. So investment in the process, how is the data used, who's using it, where is it, and so on. And finally, people. By empowering your workforce with data literacy, you can create ROI. And we talked through some examples of how by investing in data apprenticeships with Cambridge Spark, the workforce is really empowered with skills to be able to engage with data, manipulate it, present it, identify opportunities, and that saved, already millions of pounds. So that's been really inspiring. And it's also inspiring to see the next step. The next step is investing in more advanced capabilities into data science and machine learning to really move the needle and look at innovation in the healthcare space. So really enjoyable conversation. Thank you for tuning in, and see you on the next episode.
Thank you for tuning into this episode
show.
of Data and AI Mastery. If you found value in today's discussion, make sure to subscribe so you never miss an insight from the leaders driving the future of data and AI. And if you're a data and AI leader looking to upskill your workforce with the fundamental data and AI skills to transform your business, Cambridge Spark is here to guide you every step of the way. Be sure to reach out to us on LinkedIn or on our website, cambridgespark.com. Until then, be sure to keep pushing the boundaries of what's possible with data, and remember, mastery comes with continued learning and action. Until next time, stay ahead, stay inspired, and stay masterful.